We're on to learning unit number 11. In your learning unit number 11, we're going to be talking about healthcare policy and the impact of healthcare policy on health promotion. And we're going to be looking at those health promotion activities that really improve the well-being of both individuals and communities. So at the end of this learning unit, you're going to be able to analyze factors that affect how healthcare policy is created and differentiate the different levels of healthcare policy. That can be at the local, state, federal, or even global level. And describe the role of public policy in promoting social and environmental changes. And you're going to do that with limited readings this week. Chapter 14 is a chapter that is assigned. However, there's only a couple of pages assigned, 327 to 330. And that's the bottom of 330. So you're going to be reading the information about promoting health with public policy, addressing obesity with public policy, which we're going to talk more about later, and promoting health in all policies. So it's just giving you a snippet of healthcare policies and the impact on health promotion. And you're going to be doing your collaborative document answering topic number 8. And this one, I ask you to think about what could be a partnership, a commitment, that's not spelled correctly, and I will fix that, a political commitment, a community, a coalition of interest. Who else could your team work with to enhance this health promotion program? So oftentimes when we work in isolation, we can't do as much. So at least think about these things. Think about if you're doing mental health, would you be, and maybe you're doing something at the school environment, would you be working with the school nurse, the counselors there? Maybe you're going to be reaching out to an organization such as NAMI. I mean, there's all kinds of things. Who else in the area that you're going to be doing a health promotion project is involved with similar individuals of your group? So a similar population. So just give it some thought. And this is more of a thought-provoking. So I just want to make sure you go through thinking about it. Even if you're not going to include a partnership in your health promotion program, think about and respond to this topic as if, like, who else could you think of contacting and to get resources and other people that would be interested in the work that you're doing and perhaps support that work. So it's a thoughtful one this week, because oftentimes when we do health promotion programs at a larger level, we absolutely need to, in part just because of limited resources, get together with others. So again, your readings. This is a less than 3-minute video, and it's one of my all-time favorites because it so clearly identifies healthcare policy. This is by Donald Berwick, Dr. Berwick, who oversaw the Institute of Healthcare Improvement for many years. He has stepped down from that post now. And prior to that, he oversaw the Centers for Medicare and Medicaid. So he's extremely knowledgeable, a wonderful speaker, and he speaks to the 4 tiers of health policy and how it impacts on us as healthcare providers. So again, less than 3 minutes, but yet I can speak to it probably longer than what he does. You may want to watch it more than once, but this is the shortest but the most important piece of information for this week. And then again, your group project, and this time I still have commitment. I spelled it wrong again, probably because I cut and pasted it, but that's where you're going to enter your group project. And then the last thing for your discussion board, you don't have a discussion board. Instead, I want to assure that you're taking the time to click on the health promotion program proposal. As in the syllabus, you are doing both group work, and that's at the very end. You're going to be doing your health promotion presentation as a group. But before that, you're going to be completing your health promotion program proposal. So let's click in and look at this together. So, so you're looking at, it's due at the end of week 12. That's next week. And next week is a longer week. It goes through Tuesday because we're off for the Thanksgiving holiday, Wednesday, Thursday, and Friday. So anyways, I'm giving you plenty of time to prepare for this. And this is an individual assignment. That means each member of your group is working on their own. And there's a reason for that. It is assuring that all the work that you have done thus far, whether it be with your group, looking at your collaborative documents, and the meetings that you've had, you're putting it together, but on an individual basis. And it gives you a chance, what I've found in the past, it gives everyone a chance to really look at the information prior to getting together to finish off just a brief presentation of what you've done. So this is a scholarly project, an individual project. I'm asking that you're not sharing these things because you're going to share that information when you put it together in the presentation. An individual assignment, it's a scholarly project. That means it's a written one addressing your health concern. So this is going to be an individual summary of the Health Promotion Program Group Project and will be submitted as such. You're going to describe each stage of your program planning, the development, implementation, and evaluation framework for your project. So again, you're not implementing, but you've planned all of this, and you must do your own. And yes, it's APA format. So you're going to use 12 point font, no minimum page numbers, but I don't expect a lengthy paper. If you can do it in a very clear, succinct manner, that's great. So first, here's your grading rubric, and you can see it's worth 80 points. And it's, first of all, why are you doing this health promotion program? Give the rationale. And that is truly a summary of the data and the evidence that you've been gathering. What does the literature show? What are your goals? What are the program goals? What do you hope to accomplish? We could also say the evidence-based practice objectives and expected outcomes. Make sure these are measurable so that you know if your program is successful. When you set up a health promotion program, you have to have measurable goals, because when you're done implementing it, which we're not doing, I know, but when you're done implementing it, you want to say, hey, this was really successful. And then you can use that data to go after more resources, money, whatever, and make a larger impact perhaps next time. Or it wasn't successful, and then you reflect upon why it was not, improve that, and then perhaps even offer that again. So the step 3, plan. What was your plan for implementing it? How did you go about planning as if you were going to implement that program? What were the steps in it? Did you have a budget? Did you have a timeline? Were there promotional materials? This is where you have a chance to give all that type of information. And what was the outcome? Again, summary of the measures for evaluation and outcomes. So this is going to look very similar to the program goals, but you're going to say, not that you're making up information, but this is how I was going to go about evaluating this health promotion program. And, based on these expected outcomes and objectives, what I was going to do with them. How was I going to really put that together? And the last thing is that it be clear, organized, good grammar, evidence-based practice references. Again, make sure that you have a couple citations from the database. You should have been gathering that throughout, and a APA format. So that is the proposal that is due next week, not this week, next week. So I'm giving you time to work on it. So besides a couple pages of readings, your group work, and watching Donald Berwick, you're going to have plenty of time for working on this project. So thank you.